You know what? Let's get going and we'll let everybody kind of come on in and catch up. So I have the pleasure of introducing Dr. Jinny Tavee, and her presentation is titled 3 Things to Remember for Patients Living with Sarcoidosis. So she's going to talk about important actions we can take that aren't necessarily found in a prescription medication. So Dr. Tavee is a neuromuscular specialist and chief of neurology at National Jewish Health. She has a special interest in neurosarcoidosis and peripheral neuropathy and is currently involved in research in sarcoidosis-related small fiber neuropathy. She is also involved in clinical trials evaluating the effects of integrative holistic therapies on chronic neurological diseases, and has led meditation retreats for patients, physicians, and U.S. Marines returning from the Gulf War through the Wounded Warriors program. Dr. Tavee, thank you so much.
Thank you so much for having me. When they first asked me to do this, I said, well, of course, I would love to talk to the patients, but what do they want to hear about? Do they want to hear about brain sarcoidosis? Do they want to hear about neuropathy, treatments for neurosarcoidosis? And Dr. Sharp said, no, they don't want to hear that. They want to hear something similar to what you did for the FSR when you did their New Year's talk. So for New Year's, I did 7 resolutions for patients with sarcoidosis. Actually, not resolutions, I said 7 reflections. And the difference is resolutions make you feel guilty if you can't do it, and it makes you feel like you're missing something. But reflections are ideas that you can bring into your life, or you can just think about and marinate and throw away. So what I was thinking is, I've heard somewhere that people who went to Harvard Business School and the London School of Economics will tell you before a conversation, well, I have 3 things to tell you. There are 3 things to say about this. And so what I would like to do is share with you 3 things that may help you in your healing process. And the first one comes from a good friend of mine at National Jewish. Her name is Patty George. She is a pulmonologist, pulmonary hypertension specialist, and that is increased blood pressure in your lungs. It's a pretty serious disease. It's different from sarcoidosis, but some people with sarcoidosis can have it. And she was telling me the story about this Army colonel who was stationed over in Germany. He has an adult daughter who has pulmonary hypertension, and one night he gets a call and she's pretty sick. And he goes to his commanding officer and he says, "Sir, I don't know what to do. I hope she makes it." And he said, "Colonel, hope is an action. You have to do something about it. Get on that plane, go to Walter Reed, and go see your daughter." And that's exactly what he did. So for all of you and all of us, hope is an action. It's a verb. Yes, you can wish your sarcoidosis gets better, but there are so many things that you can do to make your life better. And the first thing is to be your own advocate, right? Just as everybody said, Dr. Gierke, Dr. Culver, you got to be there for yourself, for your doctor. Work as a team. But then the things that I tell my patients that you can do to change your lifestyle, out of the 4 things I tell, number 1, the easiest and simplest thing to do, well, not simple, but it's easy to understand, is using nutrition as medicine. And a gentleman was asking, well, what should I eat? What should I do? So these are things that I talk about with my patients. And the first one is protein. Protein is your friend. Your brain, your spinal cord, your nerves need protein. So chicken, fish, lean cuts of red meat if you absolutely have to have meat. Nuts. So there are so many wonderful things about nuts. They have antioxidants, they have minerals. Brazil nuts have selenium, which is an antioxidant. Cashews have copper and magnesium, which are good for your brain and your spinal cord. Almonds have vitamin E, which reduces your risk of Parkinson's disease. Not from the actual vitamin, but you have to get it from real food. And that's what I tell my patients. Get your nutrition from real food. Pistachios. Pistachios are known as the skinny nut. And they have B6 and lutein, which are good for your eyes. The skinny nut is because you can have about 20 pistachios for about 160 calories. and walnuts. Walnuts actually have omega-3 fatty acids. And so that's good for stroke and heart risk prevention. And I was so excited about eating walnuts and omega-3 fatty acids. I was eating them all day long. I was snacking in between my patients. And the thing is, you got to be careful because all of these nuts have calories. And so after about 3 months of eating walnuts all day long, I called my dry cleaner and I said, "You shrunk all my pants." And nope, that was the walnuts, so now I eat pistachios. And for the nuts, don't get the Thai roasted chili, honey roasted, get plain nuts if you can. Fruits and vegetables. The American Cancer Society, the American Heart Association, and the CDC all recommend about 5 servings a day. And it's not that hard. You think, oh, I'm not going to get 5 servings. Yes, you can. Banana and maybe some blueberries at breakfast. You can have a side salad at lunch. You'll have an orange or an apple for a snack, and then you'll have a salad or a vegetable for dinner. So you made 5. The more, the better. Fruits and vegetables, again, antioxidants. All the good stuff is in the pigment. So choose the brightly colored fruits and vegetables like blueberries, spinach, tomatoes. And you don't have to get the fancy, I don't know if you've seen this, acai berries. It looks like ACAI. Go get blueberries, right? Blueberries actually have a chemical in them that is like the chemical in Aricept. Do you know what Aricept is? It's a medication for Alzheimer's disease. And they've actually tested this in mice. They took blueberries, they made a blueberry chow and gave that to the older mice. And for the younger mice, they gave regular mouse chow. And after a few months, the older mice, some of them outperformed the younger mice on water mazes. So something to think about. Whole grains. So I usually like to tell my patients with sarcoidosis and other inflammatory diseases, try to go gluten-free. There's something about the wheat in the US. I have friends and patients who go to Italy and they'll have pizza and they're fine, but there's something about, I wonder if it's the pesticides, our gluten. We think that the gluten may be pro-inflammatory and it can stimulate your immune system. So if you can go gluten-free, try it. And if you're really gonna try, it's like you're pregnant. You're either gluten-free or you're not. There's no in between. So just try it for a couple weeks. And if you don't like it, then just maybe reduce your intake of gluten. And gluten is in wheat. But there are some grains that do not have gluten, and that includes brown rice, quinoa, teff. Buckwheat pancakes are awful, but I mean, it's gluten-free. But there's so many things that you can try. All right, cut sugar. And Dr. Culver mentioned this before earlier. Sugar, it's like the no white diet. You don't want sugar, you don't want flour. Artificial sweeteners, it may be neurotoxic. We don't have enough evidence yet, but it gives me a migraine. It gives a lot of people migraines. So try to stay from artificial sweeteners. If you need something sweet, use honey. There may be some protective element of honey for allergies, right, because of the bees and the environment. Reduce processed foods, and one of the most important rules that someone told me, that I love this, look at the ingredients. If you cannot pronounce it, don't buy it, right? You want real food. Local versus organic, I mean, Baltimore, really, you're gonna get apples and blueberries in the winter. So get what you can. I mean, if you live in California, if you live in Seattle, it's easy, but it's a little bit harder in the winter. So just get what you can. Does it have to be organic? I mean, if you can afford it, the Dirty Dozen, which are like peaches and blueberries, I mean, that's really hard to clean, and some of these things you can't clean it off. It's in the seed, so the entire thing has pesticides in it. But you know what? I'm an academic neurologist, not private practice, so I'm not gonna pay $5 a pound for apples. So just get what you can. I'd rather you have something healthy and good. Eat what you can digest. So a lot of people with sarcoidosis may have digestion issues, or with the steroids you gain some weight. And you know, these things sound healthy. Kale, cauliflower, right? You eat a kale salad and you feel good about yourself, and you look down, you're bloated, and you're like, I could have done that with chocolate cake, right? So it's not right. So just eat what you can digest. Maybe if you're gonna have a salad, just have a little bit of kale. And then reduce dairy. Again, there's not enough evidence of this, but there might be hormones and other things in the dairy in the US, so just be careful. And then they asked about exercise. For many of my patients, exercise is their saving grace. So the American Diabetes Association has recommended 150 minutes a week. And so you can break it up any way you want to, 30 minutes for 5 times a day. And it doesn't matter what you do. I don't care what you do, right? If it's Zumba, if it's jazzercise, if it's running and weightlifting, just do something. It actually reduces your risk of Alzheimer's disease too, or dementia. So that's one of the few things that have been found in these large clinical trials. Now, Matt Sutliff, who is the head of physical therapy for neurological patients at the Cleveland Clinic, his 4 rules of exercise, I love this because patients are always asking me about, well, tell me about exercise. What can I do? So number 1, pick something you like or you can tolerate. Because what's the number one month that everybody joins a gym? January. What's the number 1 month everybody quits the gym? February, right? So it doesn't matter. Like I said, you got to find something that you're going to stick with, okay? And number 2 is the most important one. If you can only remember this one, that's okay. This is the 2-hour rule. And my surgeon friends love this because they'll tell their patients this too. People always say, well, how much is too much? How do I know if I've done too much? The 2-hour rule is this. Let's say you do something. You're on the elliptical for 20 minutes. Okay, you can feel crappy afterwards and you can feel tired. But 2 hours later, you should feel neutral or refreshed. If you still feel tired, that was too much. You go back and you reduce it. So maybe you only do 15 minutes on the elliptical. But it's the 2-hour rule. Number 3, try to do something every day. Even if it's a rainy day and you don't feel that good, walk around your house. Walk down to get your mailbox. Just something so you get a little bit of exercise. Go to the store and walk around Costco. Number 4, and these are for patients who have active disease, no pain, no gain does not apply to you. If it hurts, if you don't feel well, you need to stop. Because guess what? You're going to pay for it tomorrow, right? So I would just do everything in common sense. Now, exercise in the setting of sarcoidosis has been found to be helpful. There have been many clinical trials looking at this. Some of them are combined with nutrition study and counseling and social work, but some of them are just exercise. And you can see here, it helps with fatigue, quality of life, breathing problems, exercise capacity, and depression and anxiety. It makes a difference. So again, it doesn't matter what you do, just do something. Okay. I never used to talk about this that much, but now I know how important it is. We have to sleep. Sleep is so important for your disease, for your brain, for your mental health. You know, they did this study, and it was very interesting. It's not a real study. It was, do you remember the show 2020? Oh, I think it's still on, right? I remember watching this as a child, but they did this study where they took one group of people and they made them drunk, and another group of people, and they made them sleep deprived. They didn't let them sleep for like 36 hours. And then they put them on a closed driving course, right? And so there would be these cardboard pop-ups that would come up and you'd have to avoid it. And so there would be, who do you think did better? The drunk people or the sleep deprived people? The drunk people. Like, they were showing the sleep deprived people, there would be a baby, you know, in a carriage, with a mama pushing a baby in a carriage, and they would pop up. They ran right over it. There wasn't even like avoidance. There was like tread marks on the cardboard cutout. So sleep is so important. And again, you know, dementia is making a huge wave in the media now because we have new treatments for dementia, but it's a big deal. More people are dying of dementia than ever before. And so we know now that sleep, if you get an adequate number of hours or adequate quality of sleep, you can reduce your risk of cognitive changes and dementia. And they've always said, well, what's the best number of hours? It's different for everybody. I know people can get away with 4 hours, but what they found was that people who routinely got 5 to 6 hours of sleep at night have an increased risk of dementia compared to those with 7 hours. So right now, again, it's different for everybody, but 7 hours seems to be the best time. Now, how do we get good sleep? Sleep hygiene. This is, optimizing your bedtime and your daytime activities so you can go to sleep at night. And one of the things that I love is the 10-3-2-1 rule. I don't know if you've heard of this. I didn't make it up. I saw it on the Australian Ministry of Health website, and I've seen it in the New Jersey website, so different things. But the 10-3-2-1 rule is this: 10 hours before you go to sleep, no caffeine. 3 hours before you go to sleep, stop eating and drinking. You can have water, but otherwise, don't eat or drink anything. 2 hours before you go to sleep, no more work. Stop working, and that's one of the things that I have to work on. And then the 1 hour rule is no screen time. Turn off phones, iPads, televisions, everything goes off. And part of it is that blue light effect because it tricks your eyes into thinking you're awake. Reduce alcohol. I know some people say, well, wine helps me get to sleep. Well, it might help you get to sleep, but it disrupts your sleep architecture. You're not going to get good sleep. And then one of these Stanford sleep psychologists, he said, use dimmer lights at nighttime. So don't use overhead lights like this. Use floor lamps, and that'll help your brain adjust to nighttime. And there was a recent study that just came out not too long ago, but they're looking at sleep regularity. So they found that it's not as much the number of hours of sleep, it's the consistency of sleep. It's going to bed and getting up at the regular times and getting good quality sleep that's more important for reducing your risk of death. So it's actually very important. All right. And here are some other things that you can do that have been shown in clinical trials to help with sleep. Yoga. This is not the 19-year-old Lululemon, look at what I can do yoga. This is things like restorative yoga, the pranayama breathing. It's very relaxing. Acupuncture. I was working with the wounded warriors, the Marines coming back from the Iraqi war. And I was in the Navy, by the way. I look like a Japanese stewardess in my uniform. But years ago, I was in the Navy, and what they were doing was they were doing acupuncture. And there's a place in the forehead, and I think in the ear, that can help you sleep at night. And again, there have been some clinical trials. It's mixed, but it does show that there might be some benefit with acupuncture. Tai Chi, this is a Chinese movement exercise. It's very relaxing. You can do that, and that's been shown to help with sleep. Mindfulness-based stress reduction. It's a kind of meditation, but letting your thoughts come and go. And then melatonin. So melatonin, a lot of patients just want a pill, right? I don't know if I can do all this stuff. Just give me something that I can take. Melatonin actually does help you get to sleep, but it doesn't keep you asleep. So if the problem is that you're waking up early or you're not sleeping well, that's not going to help you, but it'll help you get to sleep. And then tart cherries for my granola patients who don't want to take pills. Tart cherries have melatonin in them. All right, so last but not least, in this category, mindfulness. We all hear about what is mindfulness, right? The Google's doing it, LinkedIn, NFL, everybody's doing mindfulness now. And I think that the best definition of mindfulness came to me from a patient many years ago. He was an executive, and I was doing an EMG on him. Do you guys know what an EMG is? It's an electrical study of your nerves and muscles. It's really fun. I do them all the time. I stick needles in people, and I shock you, and I don't get many Christmas cards. But anyway, so whenever I'm doing EMG, I always chat with the patients, so I take their mind off being stuck with needles. But this one guy so we're chatting, and this one man was saying, Doc, I died last year. And I was like, I'm sorry? He goes, yes, I died last year. And what had happened was he was playing tennis at his club, and there was a nurse who was playing on the court next to him. She finished, and then he finished shortly after her. He walks into the country club, drops down dead. He drops down. Suddenly, but the nurse had just walked in right before him. And so she and the attendant grab the AED off the wall, shock him back, and he's life-flighted to the nearest hospital. They find, triple vessel disease in his heart. He'd had a heart attack. And the cardiologist opened him up, and he was fine. 4 days later, he woke up. And I was like, wow. I was like, did you see a light? He goes, yes. I was like, really? And I didn't mean to be snarky, but you hear that all the time, right? And he goes, no, it's not what you think. And he said what it was that all I remember, I don't remember anything about the hospitalization, but what I remember is this. I remember the feeling of ascending, going up, and looking down, and all I could see was the tops of houses. And then I remember this blue-green light. It was really peaceful, and it just bathed everything. And then I woke up. And ever since then, I've appreciated every moment. I enjoy every moment. And I was like, really? You enjoy every moment? You enjoy standing in the line at the grocery store when someone is writing a check and trying to use her coupons, right? And he goes, well, no, I don't enjoy it, but I don't mind it. And that is mindfulness. Being in the moment, right there, without putting a judgment on it. I hate this. I don't like that. I love this. He said that being in the grocery store and being at his daughter's graduation, you appreciate every moment because you're here, the fact that you're here. And so that's what it is, not judging the moment. And so what can we do? There are practices that can help us with this. Mindfulness meditation is when you can just focus on your breathing. When a thought comes, and it will, you just bring it back. And you don't judge anything. Concentration meditation is when you just concentrate on an object. It can be your breath, but it can be something in your hand. It can be a bracelet, whatever it is with your faith. You can hold something in your hand. Some people, remember the Beatles? My residents didn't know who the Beatles were. I felt so old. But the Beatles did chanting. They did Om, Om. And then movement meditation. And so for patients whose minds, for people, not just patients, but people whose minds go like this, I don't know how many people have this, right? So your minds go like this, especially, when you're anxious and you don't know what's going on, then I think that movement meditation might be the best for you. So yoga, Tai Chi, Qigong, look at what your community offers, because I was taking Tai Chi when I was in Cleveland. By the way, Dr. Culver, I think he's gone already. He was a year ahead of me. He was my senior resident at the Cleveland Clinic many years ago, maybe 2 years ago. But no, I'm just kidding. But anyway, so I took Tai Chi classes in Cleveland, and my teacher was amazing. His name was Robert, and he was African American, and he was so good. And I said, Robert, only in America can a black man teach a Chinese girl how to do Tai Chi. So Qigong is similar. It's movement meditation with breathing. And so what happens in the mind? What's interesting is, so there was this study done at Columbia University where they wanted to know about secrets. How do secrets affect people's lives? What do you think was the number one secret that Americans had? Just guess. Anybody?
Cheated on their taxes.
That was one of them. That was the biggest one. So cheating on the taxes, lying, theft, drug abuse, trauma. But the number one secret that people had was thoughts of cheating on their partner. Thoughts. But it was interesting is that what you did or what the secret was didn't bother the people as much. And how many people knew, how long you'd had the secret. None of those things mattered as much as one thing. How many times did you think about it in a day? That's what caused the worst quality of life. How many things you think about, and how many times you thought about it. And that's what we do, right? We have recurrent thoughts. And there was a Stanford psychologist who estimated that there are 60,000 thoughts that go through our minds every day. And 90%, and I'm being generous, I'm being very nice, 90% are about ourselves, right? And most of those thoughts are garbage. So what we're trying to do is to get in between the space of those thoughts, because that's where peace is. And so mind-body therapies have been studied in sarcoidosis. Leslie Setketku, many people know her. She just spoke yesterday from New Orleans, and she did this one session of mindfulness training for sarcoidosis patients, and patients felt better quality of life, reduced fatigue, and reduced depression and anxiety. Cognitive behavioral therapy, this was a European study, and they found that they were doing this cognitive behavioral therapy online where, you're doing kind of like a meditation thing, and you're thinking about how thoughts can affect your life, and reducing those thoughts and replacing them with more positive thoughts. It didn't show anything after 6 weeks, but there was an improvement in depression and anxiety after a year, or depression and fatigue. So these mind-body therapies do work. It's hard, I get it, but again, join a class if you've got something in your community. There's so many online apps and websites you can do to look for meditation. And these are some things you can do every day. So my mother, just as a disclaimer, is a Buddhist monk in Thailand. And I mean, she waited till after my brother and I finished med school, but she teaches meditation to people all over the world, and she has a temple in the rainforests. But the way she taught is, you don't have to get on the floor in an Indian style and torture yourself. My mom teaches that you can sit on a couch, right? Sit in a chair, sit wherever you're comfortable. Dim the lights and just close your eyes and focus your breathing here at the diaphragm or here. And that's it. And just do it for 5 minutes a day. And then as you get better and better, you can do 5 minutes, 10 minutes, and then work your way up to whatever's comfortable for you. Even easier is taking 5 deep breaths. So when you're driving, you're stuck in rush hour, and somebody cuts you off, and before you give them a lovely finger gesture, you take 5 deep breaths. And it really does reset you. If you work or if you're at a desk all the time, my mother always said, look out the window. If you're feeling stressed out, look out the window. If you don't have a window, look up at the corner of the room. And that's like your own personal Control-Alt-Delete. It resets your mind. It gets you out of it just for a second. You'll go back in, but at least it gets you out and it gives you a chance to reset. And then mindfulness with walking. Walk quickly. No iBuds or whatever they're called. No dog, no friend. Walk by yourself. Let things come and go. And that serves as kind of a paradigm for thoughts. Let things come and go. Okay, the second thing that I'd like you to think about and remember is the power of gratitude. Gratitude is one of the most powerful tools we have for mental wellness and resilience. And the reason why is it keeps things in perspective. When you're thinking, I don't want to be like this, why? I don't want to be like this, I don't want things to be like this, why can't it be that way? Gratitude, being grateful for something, brings you back to the present moment, and you appreciate what you have right now. Not what's out there, not what you want it to be, but what you have right now. And the reason why this is so important for patients with sarcoidosis is that healing is not linear. You're not going to do this. Every day is not going to be better than the last. Your trajectory is good. You're going to get up. But especially when patients are recovering from active disease, I'll tell them, you've become like this fragile flower. Things are going to throw you off. Being sleep deprived, missing a meal, being dehydrated, being stressed out, having a little bit of a cold, that's going to set you back a little bit. Doesn't mean you're going backwards, you're just taking a step backwards, just temporarily. But what you need to do is to be grateful for how far you've come. Be grateful for what you have right now. Keep a positive attitude and know it's going to get better. And the other thing is that it helps to reset your the framework of how you're thinking. Because the key to happiness is closing that gap between the way you want things to be and the way they really are. I remember many years ago when I was in Cleveland, I was working late in my office, and one of the nurses came. She's pregnant, and she came to my office, and she's like, Dr. Tavee, I have a question for you. And so she was 8 weeks pregnant, and she thought, because my mother was a Buddhist monk, that I could predict the future. And the fact that I haven't won the lottery should be a clue that I cannot predict the future. But the point, though, is she came to me because this was her 4th pregnancy. She'd lost the first 3 pregnancies. The most she'd ever carried was 10 weeks. And when she came to me, she's like, is my baby going to make it? And I was like, oh my gosh, I'm so sorry. I don't know that. But, sometimes, when a baby has many, many genetic mutations, it's not compatible with life. So, what I can tell you is this. It's not your fault. but be as healthy as you can and pray. Just pray every day, because she was Christian. So I said, pray every day that you're going to have a healthy baby. And that's what I could do at the time. So she went away, and then a few weeks later, she came back. Now she's 12 weeks pregnant. She made it past her 10 weeks, but she's even more anxious. She's even more nervous. And she goes, Dr. Tavee, I pray all day. I pray every day, every minute. And I'm just so scared. I've never carried a baby this far. And I looked at her fingernails. They were bitten down to the core, and I thought, I better tell her something different. So I said, okay, instead of praying that you're going to have a healthy baby, every night before you go to bed, I want you to pray and say, thank you for letting me have my baby another night. And every morning before you wake up, I want you to say, thank you for letting me have my baby one more day. And she did that. And a few months later, Jackson, a beautiful baby boy, was born, and he's fine. But the point, though, is that when your mind is wanting something, right? And you want it so badly, you don't know what to do, and you want to be better, you want to heal, you want to get off the steroids. What does that do to your mind? It makes it anxious and worry, right? And you don't feel right, and you're scared. But when your mind is in gratitude, thank you. Thank you for getting me as far as I am. Thank you for the support system I have. What happens is your mind is calm. It's peaceful. It's reflective. And that's why gratitude works. And so what do you have to be grateful for? Yes, it's your support system. It's your friends. It's your family. It's the sarcoidosis community who cares about you. And it's you. You are something you should be grateful for. You made it this far. Be grateful for little things like a taper in steroids, even if just 1 milligram. We get it. We see patients all the time with all the steroid complications. I had one guy who told me, I've been on steroids, so much steroids, my wife is having side effects. So it's real, and we get it. So even if it's just 1 milligram, you're like, I made it. I made it down to 4 milligrams from 5. And the 3 main things of steroids, I'm sorry, I don't have my glasses on. Am I almost out of time? I'm almost done. So 20, 10, and 5 are the magic numbers for prednisone. When you get past 20, side effects come down, but that's when you start to get tricky. It starts to, you don't know if you're going to have a relapse. 10 milligrams, same thing. 5 is the biggest one. You got to go really slow. I do 5, 4, 3, 2, 1 over certain periods of time. Reduction of medications. You know, I tell patients, when they have brain sarcoidosis, you're going to be on the infliximab for about 2 years, give or take, right? And so as we get closer and when we're able to taper it down, maybe not every 4 weeks, maybe every 6 weeks now, be grateful for that too. And then finally, when you get your test results and the chest x-ray is better or the PFTs are better, then be grateful for that too. There are so many things that you can be grateful for every single day. And exercises that we can do. So before I eat, I always say thanks. I say thank you to all the beings that brought this food to my table. Thank you for all the beings that take care of me. And you can say that too. You can do whatever you want to. And there was a German philosopher many years ago who said, if the only prayer you ever said was thank you, that would be enough. So just find ways to thank people and things. And so the last thing that I want you to remember is, so again, this was the same friend, Patty George, who is a pulmonary hypertension specialist. She's also a competitive cyclist. Like, she actually races across the U.S. from San Diego to D.C. They get in vans, they do rotations. She's insane, but I love her. And she's like the Ted Lasso of, if anybody knows who Ted Lasso is, she's like the Ted Lasso at my hospital. But anyway, so she was telling me, so she was in a bike race in the mountains in Utah. It was minus 35-degree weather. And she was pedaling on her mountain bike, and she said, I couldn't get traction. It was so icy, I couldn't feel my legs. It was so cold, and I just wanted to stop so many times. And then she remembered being in a cyclist boot camp where the instructor was saying, no matter how bad it is, no matter how hard the trail gets, I want you to remember one thing. The trail always changes, okay? It's going to change. So just when you think you can't do it, just keep going, and you can. And so in this race, she's going up this hill, she's slipping, and she's like, I gotta quit. And then suddenly, she comes up on a clearing. The bike is now flat. The trees have icicles dropping from them. The stars came out. She could see her breath, and she said it was the most beautiful thing she'd ever seen. And so for all of you, the trail always changes, even when you think you're at your worst and you can't do it anymore. Keep going, just keep going. And know that the sarcoidosis community, your doctors, the support groups, all of these people, your friends and your family, we will fight with you, and when you're tired, we will fight for you. And then one really important thing, so this is from, I didn't make this up, this has been in a number of clinical studies. It's different for every single person, but when they look at general sarcoidosis, not every single person, depending on what organ system you have and things like that, 70% will get better spontaneously. So even if I was the worst doctor in the world, you come to me and I was like, I got nothing for you. You're gonna get better. 70% are gonna get better. So the odds are in your favor. And I want you to remember that. So this is my last slide. This is my mom's temple in Thailand. This is a trail. So the trail always changes. Thank you.
Thank you so much, Dr. Tavee. So Dr. Tavee is going to be a part of our moderator.